I am the president of my local nurses union, which is affiliated with the Ohio Nurses Association and the American Federation of Teachers. I would like to share with you that this afternoon I was actually mandated off of work on a 7-day quarantine and mandated to be tested due to a possible workplace exposure and development of symptoms. So my question, Vice President Biden, is when nurses are being placed off of work and having to run out of our PTO and are not being paid, and we start defaulting on our mortgages and are unable to afford groceries or our student loan payments, what should the government do to help them?
You're incredible. You're absolutely incredible. And you deserve, at a minimum, what you give to everybody else. So let me start off by saying that one of the things that the emergency paid leave that was passed applies to everyone on top of your current paid leave. It would cover 14 days of paid leave or the duration of the quarantine that you're quarantined. So if you'd never have to worry about running out of paid time off or because you're sick or because you're exposed to the virus. That's what I meant about the management of this legislation that passed now. How do we let you know? How does the government let you know how you get it? When's the check get mailed to you? And will it get mailed to you on time? You should have never been put in this position in the first place. You should have had the equipment, number one. Now that you have been put in this equipment, we should at minimum take care of the financial burdens that are imposed on you as a consequence of what you're doing, what you've done for others, and what needs to be done. So I promise you, that was the commitment the legislation made. That's the commitment you'll get. And if you don't get it, you let me know and let any of the nurses. By the AFT is a great outfit that you all belong to. You represent thousands and thousands of people who are out there every day. And so I've been working with your national president as well to make sure that everybody understands that you are entitled. Entitled. It's not a gift. You're entitled to what has just been passed.
This pandemic has many consequences, many known and unknown. As a healthcare worker on the front lines, we're facing this crisis in real time. And like our vets, PTSD is real. And you had touched upon this in your first question, in that a lot of times we deal with the patients, we face death, and we're just told to pick up and move on to the next patient, and without any debriefing or anything like that. So what are your thoughts about the mental health of our healthcare workers and frontline responders and doctors, nurses, EMTs? What are your thoughts on the briefing protocols, and what problems and possible solutions do you foresee in this foreseeable future post COVID-19 for our mental well-being?
Well, first of all, thank you. And docs and nurses and first responders, you're all kind of trained. You're not going to show any weakness. And somehow you think if someone is suffering from PTSD or having mental health and anxiety problems, that is somehow you're not supposed to let anybody know, even though you're professionals. The truth is we have to provide more mental health facilities and capacity for all of you that in fact need it. And it should be funded, and it should be funded now and paid for, and it will be paid for. But the point is, first of all, we got to get over the stigma of saying, hey, I need help, number one. Number two, we should be providing significantly more help, and it hasn't been there now yet, for mental health, so that you have a place to go within your own hospital to seek the kind of assistance that you need from professionals, from professional mental health personnel, to be able to get the kind of help that you need. And it's overwhelming the interest, and you should not be in a position to have to pay for that mental health. You need to be able to be covered.
Thank you, Vice President.
Well, thank you.